Thank you very much. Welcome, everybody. We're having a morning meeting, the last one of this calendar year for the Board Finance Committee, and we have a stellar group of presenters today. But before we get started, Rob is going to tell those folks online how they may or may not be able to participate properly and improperly, and he'll decide that. And then we'll go around the horn and introduce all these good people that are here, and then our presenters will begin right away. Rob, please.
Good morning. If you'd like to speak during the Speaking to the Public this morning, please click the hand icon. We will then ask you your name and association to the district, and then we will invite you to speak during the hearing of the public section of the agenda. Thank you.
Thanks, Rob. And now, my name is Eve Bolton, and I am a board member and currently, one more time, the chair of this committee for this calendar year. And we'll go around the horn and introduce yourself. Make sure you use the mics, speak up, and speak into the
Good morning. Thank you. My name is Adam Geffner, and I am the Director of Financial Technology.
Good morning. Cody Hutchins, Contract Analyst.
Kevin Ashley, Director of Financial Reporting and Transparency.
Michael Gustin, Assistant Treasurer.
Good morning. Lauren Roberts, Chief Audit Executive.
Good morning. Jennifer Wagner, the Treasurer and Chief Financial Officer.
Good morning. Dr. Moffitt, Board Member.
Eve Bolton.
Brandon Craig, Board Member.
Mona Mansour, guest.
Angie Maddox, I am the School Health Manager.
Emily Dale, President, ASME Local 232.
I'm David Fred, I'm a member of the Audit Committee.
Thank you all for being here. We have, as always, a full agenda, but we have an unusual part of the agenda today to begin with in this time of rethinking our money, rethinking services, and celebrating those things we do well and looking to things that we can improve. I would just as a preface like to suggest that too many times when we talk about these difficulties that we might be in as we put a budget together, we do focus on what we don't have, and sometimes we need to focus more on the assets that we have and see if those assets can also help figure out how we can better improve the rest of what we do. So the other piece I like about this is that I think this is one of the great partnerships for the district, and I like the language they use. So does, I think, Jen, so I've heard her use this as well. Integrated, coordinated, and sustainable. And so with that, we're going to introduce our first presenters, and I go to the good Dr. Mona Mansour, and she will introduce herself and her compatriots.
Thanks so much, Eve. Thanks for having us today. We're here on behalf of Growing Well Cincinnati, and as Eve mentioned, I'm Mona Mansour. I'm a general pediatrician from Cincinnati Children's. I wear a lot of hats there. I'm the medical director for our school-based health centers. I am also now the new medical director of our coordinated school strategy. But today I'm here wearing my hat as the primary lead of the primary care committee of Growing Well. And I'm here today with Francie Wolgan to my left, who is the executive director of Growing Well, with Angie Maddox, who you all know is the school health manager for Cincinnati Public Schools. And then online we have Adrian Serbu, he is one of the school nursing supervisors from the health department, and Marilyn Crumpton, who I think all of you know from a lot of former roles, but is here in her role as a member of our Ohio School-Based Health Alliance board. If you could go to the next slide. Our objectives today are to provide some information and context to this board for resource planning for your budget process. We wanted to share a little bit more about Growing Well for those who may not be as familiar with this entity, and how Growing Well supports school health and the school-based health center model in particular in our region. We wanted to describe the different types of school health services that are being provided in Cincinnati Public Schools with the different types of levels of providers, those school-based health centers, the registered school nurses, and the licensed practical nurses that are providing a great wide range of services, as well as the impact of these services on the population in the district. And then I'm going to turn it over here just briefly to Francie to share briefly around Growing Well, and then we all know when we're talking, so we'll go in our orders.
Good morning. Growing Well is an organization that operates as an independent organization designed to develop, support, and offer technical assistance to promote sustainability of school-based health centers in the greater Cincinnati region. Next slide. And these are the functions of Growing Well, but Most particularly, Growing Well has been providing numerous functions. Since its inception, we were recognized for our collective data reporting and coordination of the numerous provider partners, which would be the medical partners of the school-based health center. Today, we are partnering in this presentation to provide education and information about school-based health centers.
You can go to the next one as well. So I think most people here are likely aware that school-based health centers are unique settings in schools that provide access to care and reduce disparities that require collaborative commitment from the community, the schools, and the partners that are providing services. They're designed to complement existing school health nursing services, as they are really similar to the level of care that you would receive in a physician or doctor's office. The school-based health center model is predicated on a minimum standard of providing primary care services, which includes things like well-child checks, acute illness care, acute chronic illness care. And the primary care in these centers are typically provided by a nurse practitioner, and that's the typical model here in Cincinnati Public Schools, or some of them, there are physicians that are providing those services. Across the country, these models do also facilitate access to additional services that include mental behavioral health, vision services, dental services, and even specialty care through really fantastic community school partnerships. In CPS, we have 2 school-based health centers with vision centers that are at Euler and Academy of World Languages, and there are 5 schools with dental clinics that are listed on the slide. Not kind of the scope of what we're talking about, but also just worth mentioning that all of the Cincinnati Public Schools have mental health partners through a community mental behavioral health agency with a partnership with Mindpeace. So just to kind of give a sort of an overview of that. The school-based health center model operates most effectively when there is a school nurse partner, but there are models out there that utilize school health aides, school health assistants, similar to the model that Cincinnati Public Schools had prior to the pandemic, where there was a model where there was a blend of school health assistants and nurses, and that model does require just an RN as part of the model for supervision purposes. And then just a reminder, we always like to remind, because this is a sensitive topic, that the school-based health centers always provide services under the model of requiring parental consent for the students. School-based health centers are critical to providing access. Why do we do school-based health centers? They're critical to providing access, obviously, to students who would otherwise go without that care. They're also really important to parents and guardians, especially for those parents and guardians from our low-income families who often have jobs and employers that are less forgiving about them being absent from work. The school-based health centers allow students to return to class or miss less class than traditional healthcare models that require them to leave the building, yielding more access to that instructional time, more seat time for students. More importantly, too, they also help teach these students critical life skills on how to access healthcare. And many of our school-based health centers in Cincinnati Public Schools also provide care beyond the population of students, so often to children under school age or to adults. And that really expands the impact of the school-based health centers on the broader community, recognizing that a lot of care is multi-generational. And then finally, we know school-based health centers have impact on a variety of outcomes, not just health outcomes, but educational outcomes and financial outcomes, which I'll share on the next slide. There are a variety of studies. This is a slide that comes from the Ohio School-Based Health Alliance, but there's a great deal of literature that talks about how school-based health centers impact not only decreased utilization, reduced admissions, better actually access to preventative health care, better chronic disease management for things like asthma, ADHD, depression, positive behaviors of students, but we also see impacts on education, so better graduation rates, increased school engagement by students, decreased chronic absenteeism, decreased disciplinary actions, and better high school graduation. But we also see societal impacts in studies from school-based health centers, introduction into schools that have better and improved societal costs that are really fantastic. Get that increased economic productivity of parents and families, and keeping kids out of really costly care. Next slide. So where are the Cincinnati Public Schools school-based health centers? There are 24 of them in CPS, and we've listed their primary sponsors. The health department leads with 13 school-based health centers, but there are also school-based health centers that are operated by Cincinnati Children's, by Crossroads Health Center, by Mercy Health, Bon Secours, and Winton Hills Medical Center. I won't go over the details of the slide, but it's just important to note that it's very critical to being able to provide school-based health center services to be able to bill for them. And so the level of service that we provide in a school-based health center is different than the level of service that's provided by a school nurse or that's provided by a licensed practical nurse. And so just critical for us to continue to provide the services, we need to be able to provide that level of service. The next slide is the data that from Growing Well that Francie sort of alluded. One of the really critical things that Growing Well has been able to do is be able to pull together all the collective partners in the Cincinnati Public Schools to provide data. And here you can see, and this is our last full year of data from 22-23 academic year, but you can see that there are over 26,000, almost 26,000 medical visits for chronic illness or acute illness care. These are things like children coming down for asthma attacks, kids that like maybe thought they had COVID or a respiratory illness, children that may have had a sore throat or ear pain, that kind of thing. We've also had almost 5,400 well child visits or preventative care visits. We've given almost 9,400 immunizations, which obviously keep those kids healthy, but other kids healthy by preventing spread of disease. We've had almost a little over 4,300 vision exams, where 72% of those children receive glasses, and almost 22,000 dental visits with about a little over 12,000 users of those services. And these are just the services that were provided as part of the school-based health center model, but you can imagine that this is really a significant amount of impact on kids of the district, allowing them, to have their health needs met and then be able to be more actively engaged in their curricular activities. But now I'm going to turn it over to Adrian, who's virtual, so hopefully this will work well, to share a little bit about the health department registered nursing services. And Adrian, if you're talking, you're on mute, or we can't hear you.
Okay, can you hear me now?
I can.
Okay, perfect. Hi, everybody. My name is Adrian Serviu. I'm the supervisor of the night department. Sorry, I was unable to be in today. I'm going to review some of the roles of the services that are currently in schools of the Cincinnati and how those differ from school centers. As Mona mentioned, school-based health centers are for students that have been given guardian consent to be seen by the providers in those sites, and the school nurses that are in charge of all of the students in the building that they are. Your school nurses in Cincinnati Public School are public health nurses now with the department, and we are tasked with managing the electronic health record that is housed within PowerSchool. So with that, we are completing health history updates that are submitted by parents of the district. We are managing immunizations and immunization compliance. We are completing state-mandated screenings for vision, hearing, dental, and BMI. And we are also managing any referrals for care, whether those referrals be from failed screenings required by the state or any medical referrals based on student needs when they come into the nurse office. We also take care of chronic illness management, and some of the chronic illnesses that are managed are asthma, diabetes, seizure, sickle cell, and migraines. So we work with the providers of those students to make sure we have health plans and care management plans on site so that those students can stay in school and be healthy in school. On a daily basis, anything and everything walks into a nurse office. So anything from daily medication administration to sick and injured students, that is what the school nurse is tasked with. And then lastly, we are part of making sure that the staff of the school system is ready to administer or medication when a nurse might not be on site. Next slide. So this again is data from the 2022-23 school year. There are currently 48 licensed registered nurses that are tasked with covering 65 school buildings across the district. from the enrollment year of 22-23, there were 35,000 children that we pulled that when we run the report in Power School from pre-K through 12th grade, and 32,000 of those from kindergarten through 12th grade, if you take out pre-K. Of those children, a little over 6,000 of them have returned health history forms from the parent or guardian. This is something that we are working on. That it was a difficult task to get through during the pandemic, so we are trying to get those back up from the parents to get health histories updated. Next slide. As far as immunization compliance, we just, again, this data is from the 22-23 school year. Just to let you know, as a district, you are at 84% compliant with immunizations, and the compliance is specific to those state mandated immunizations for the state of Ohio. Next slide. As far as medical visits and screenings, this is specific to the school nurse office. So you can see for the 22-23 school year, there were over 64,000 visits to the school nurses. That can encompass, again, a lot of different reasons for visits, but anytime a student comes into that school nurse office, we have the ability to document that in Power School in the health record so that we are able to manage and follow that student for any needs. With those 64,000 visits, there were over 3,000 or about 3,000 medical referrals based on what we saw. And with all of the screenings that were completed during that school year, there were over 16,000 referrals made for students that needed more care or more screening. Next slide. CPS is part of reporting body mass index screening to the state. So we do currently offer that. It is not a mandate, but we do offer that to all students when we're doing all of the state required screenings. And with that, we have the ability to refer students if they need further education or any help based on BMI screening results. Next slide. For asthma care, which is one of the chronic illnesses that we manage that, if you're not aware, is one of the top illnesses among children in the city of Cincinnati, we do complete an ACT score on each of those students that have asthma. And an ACT is a questionnaire that can help us understand how well that student is currently doing with their asthma symptoms and how well they might have control over their asthma based on their care plan. Just to show that if you have a school that has a school-based health center where we can get consent and be able to refer that, we have a higher percentage of completing an ACT score and being able to have that student be well controlled with their asthma. Next slide. We wanted to just provide an example of how much the school nurses are doing as far as just not outside of medical care, just being that safety net for the students in the building. This was an anecdote from one of our nurses. This student that came into the nurse's office during this visit was a student that uses that nurse office bathroom regularly because that is where they feel comfortable based on their current needs. So she comes in quite often. During that visit on this day, she was struggling, and the nurse was able to speak to that student and find out that she did have a plan to take her life during that day, and that nurse was able to intervene, have the student be able to speak to her and get her referred and get the right parties involved so that that did not happen at the school. The student is doing much better now, and things are moving forward, but just knowing that the relationship between the student and that nurse is most likely what saved that student's life, as far as being able to have that student speak to the nurse on that day that they were struggling. Next slide.
Angie?
Yeah. Hi. So another part of school health that CPS handles are our licensed practical nurses. These nurses, we have 20 in the district. 11 are actually CPS employees, where our school nurses are health department nurses. Our LPNs are CPS nurses. We have 20. 11 of those are CPS employees, and 9 we use agency nurses. They serve 48 students with medical disabilities in the district across 18 schools. 13 of those students require a one-on-one nurse to stay with them the whole school day. And these nurses deal with things like feeding tubes and trach care and airway catheterizations and ostomy care. In a handful of our schools, we actually have 2 of our CHD nurses who do some of that skilled care, which may include a water bolus, a catheter, or a G-tube feed. We have a team of CHD nurses who help kind of manage getting the health orders and the individual health plans for these students, and making sure that the right nurse is working with the right students and that our students are getting the care that they need while they're in school. Prior to the COVID-19 pandemic, CPS utilized a model for school health services using both registered nurses and school health assistants. Several of our schools have pretty high medical need in the building. They may have, a high need of diabetic care or just a great deal of students, which just means there's more visits to the nurse's office. Many of our schools do need a full-time school nurse, but many of our schools would do well with a school health assistant handling those things in the nurse's office. The need of which schools would need an RN versus a school health assistant, it's determined based on medical acuity, which is a collaboration. We work really closely with the health department, determining, who needs to be where. Some of the benefits of school health assistants, they can focus primarily on medication administration, diabetes care, and basic first aid, which would allow the other staff in our schools to focus on their own job requirements. So we wouldn't be pulling teachers or front office workers or principals to do that care. We would have a dedicated person in the building to handle, some of those medical needs.
Back to me. I think just, Angie was talking about some examples of really great collaboration, but I thought it would also be helpful just to share some additional examples of really fantastic collaboration that have happened between the various partners here. We actually have a school district hospital improvement network that Cincinnati Public Schools participates in, but a bunch of other districts participated in. There's a really great collaborative where they've worked on improving sort of the process by which community pediatricians and pediatric providers were communicating with districts around requesting, or when they were interested in or felt a young child would benefit from an individualized education plan. So a process that really elevated education voice and into the sort of process of how we do that as pediatric providers. There's a transition of care network for mental health. So this is a partnership that, again, multiple districts participate in, but is there to support the transition of patients that have been admitted for mental behavioral health reasons back into school, and to have a safe transition. And then more recently, we have a great collaboration between the district, the health department, and children's with our GI department. As Adrian was mentioning, we have children that need orders and individualized health plans, but there were some students that were actually not easily getting back into school because of delays in orders. So really working to kind of standardize, how we do that, and actually working on how we can do that proactively before the beginning of next school year, so we can keep those kids in the school environment. Great collaboration between all of us during the COVID pandemic that got published in the Pediatric Journal, and then a really fantastic asthma learning health system that is really focused on reducing disparities around asthma, where school health is really a critical partner in being able to improve outcomes for kids and keeping those kids, in their instructional environments. Next slide. So just, I think in conclusion, we just wanted to share that we really believe that, that these students' school health services are vital to the health, wellness, and educational outcomes and success of students. That school-based health centers do deliver that higher level of care that's similar to the care that's provided in the physician's office. that having some type of school nurse or health resource in each building to support the health needs of kids is really, I think, important. That coordination of care is critical, I think, to the ultimate success, of students. And that what these RNs, LPNs, and school-based health centers do are unique and different, but complementary, and are really building that sort of collective supports for ensuring kids are there to learn. And that in our current state, medication administration by delegated personnel really is critical to make sure kids get what they need in order to be successful in the learning environment. But alternative models could certainly address that, in a different way. We talk a lot in the healthcare universe around social determinants of health, and how those are so critical to impacting the outcomes of kids. But I think a lot about the social determinants of education, and health is such a critical part of what is going to make kids successful. So I'm hopeful that the information here has been helpful for you all as you make decisions, and we'd be happy to open it up, for any questions that you have about what we've presented. All of our contact information is on the next slide if there's anything people want to reach out around. But I will stop there and open up for questions.
Very much for the presentation. Impressive as always. Members of the committee, questions, comments?
Do you want to go first? Okay, then you can go first. Okay, well, thank you so much. This is great information, and I apologize for being late and running in. I kind of forgot that this was at 9 o'clock instead of 10:45, so I had to adjust appropriately, but thank you so much for this info. I do have a couple of questions. I like the fact that you said social determinants of education, so I wrote that down because I like that. That's pretty crafty. Three questions. I'm very interested in and have asked before around the number of students that are directly impacted due to the lack of healthcare in our buildings. You mentioned it on the previous slide, well, one before conclusions, they didn't have numbers, but the students, you mentioned it as the number of students with delays in academics due to healthcare or the lack of, or they need something special. I'm very interested in that number and would really like further information. I kind of want you to pull that off the paper for me because that's super significant. That sounds to me in lay terms like we're not adequately supplying enough nursing staff or healthcare access for students to be able to come to school. I don't know if that's exactly what you mean, but that's a concern. So because for a multitude of reasons, but I kind of want you to explain that number. And if you don't have it today, that's fine, but that's of interest to me. Another one is the management of healthcare records in PowerSchool. How does that tie into like my chart? Because I know there is a whole thing around HIPAA that the hospitals are working on and that they can't share some information regarding medical. And when you mention that you put that information is in PowerSchool and you manage health records, I have some concerns about that. And would like a little bit more information around that as far as what exactly are we managing and what are we manipulating and the liabilities of such for us to do that. I think the data that you provided around the immunization and some of the other healthcare things that you all are providing to our students, very impressive. But I'm also interested in how does that compare to school districts that do not have health-based centers and that have to utilize like their local children's hospital or something of that nature. Are we comparable with that? Are we complementing what is being seen? Is it a benefit? It looks great impressively in a silo, but is that really comparable to be at 84% here? And then the last thing I want to say, and I promise it will be the last thing for a moment, you mentioned that our school-based health centers serve the population that you mentioned slid more towards like low income families, and that is the case, but they're also open to the public as well. And I think that didn't get mentioned enough, and it doesn't get mentioned enough that we've got people who our school-based health centers can accept regular insurance in some cases, And we've got people who utilize that because of proximity in their communities. And so that doesn't get pulled off the paper nearly as much. And it didn't get mentioned here, but I want to make certain that people understand, for the record, our school-based health centers are not just for low-income students. It does serve the population, and it helps us with that regard to academics, but it also is great for our elderly population that want a close walking place, and the way that they're situated, they have a separate entrance from the school, so they don't have to go in there. That stuff doesn't get pulled off the paper enough. But if you could get that other information, that other data, I'd be most appreciative. But thank you so much.
Do you want me to try to answer those? Do we have time, or do you? Okay. And Adrian might have to help me. Might have to help me a little bit with the Power School one.
Power
School. But like in terms of the number of students that are lacking health care, it's a little bit of a difficult number to get from the data that we specifically have, from Growing Well, but sort of just, kind of if you look at figures of kids, I mean, one of the reasons we have the school-based health center model is that we know kind of from other data sources that anywhere from sometimes 15 to 25% of kids don't have access to a patient-centered medical home. And so I think some of the idea here is we're trying to kind of close that gap, but I will see what I can follow up with to see if I can find some additional, more specific information there. I'll let Adrian talk a little bit more specifically around Power School. There are not like currently kind of direct connections between Power School and like MyChart, Epic, EMR, like hospital records. The information that they're documenting is the information they're documenting as school nurses. But there are actually some really incredible, we are learning some data sharing partnerships, again, with the appropriate, legal people involved in following regulatory requirements that we're learning about from other national groups around how to share data between, healthcare providers and educational providers, so that we can start to really begin, this really intricate intersection between absenteeism and educational outcomes. We are actively sort of participating in that and hoping we can bring some more of that knowledge, to the work that we do, collaboratively. But Adrian, I don't know if you want to sort of chime in around, kind of a little bit more about the information that's in Power School and what you're doing there. And if you're talking, we can't hear you. That's always
Go ahead, Adrian.
Thank you. I'll speak to the Power School information. So when calling it an electronic health record, it really is specific to being able to chart updates on a patient regarding health information, not on paper, but being able to have it in electronic format so that we can run reports and keep track of what's happening with that student. We don't have a connection with Epic, so we are not changing anything patient's true medical record with their provider. We're documenting health history information that's been submitted by the parent, so that we are ready in case there were an issue that came into our office with a student. We know what might be presented from that student. Immunization records are being kept in there, but that does not interact with the state immunization record that is kept. So we have just our own record to be able to access as needed. So it's almost like having a closed system, but being able to document and track information on that student electronically instead of via paper chart or paper, kind of like you guys have with the CUMES. Does that make sense?
Yes, that is a good answer. Somebody's nodding yes, so I think that's good. Member Craig?
Yeah, again, I think it's so important for us to recognize that a large part of what we're doing with the school-based health centers is really focused around the fact that we know that there are communities that just don't get healthcare assistance, right? And it's a traditional thing that goes all the way back probably to the start of us having schools, period. So I think it's not just admirable, but it's necessary in a lot of ways to ensure that our students get access. I wanted to maybe lift or ask a question around the school health assistance model, because I think that was, we oftentimes hear about how many nurses do you have in each one of your schools. And we have to also recognize that not every school has the same needs or that role of a nurse in the same way. And that's not how the schools were set up prior to COVID even. And so I think it is an important aspect of, maybe the question shouldn't be how many nurses do you have in your school, but how many folks who provide health or medical assistance within the school, right? Because I think that's more maybe the question that needs to be asked, especially if a school is heavily populated. You may need more than one. If school is low populated and doesn't have a lot of healthcare on a regular basis needs, maybe the health assistant model fit better for that particular school. And so I think that's an aspect that I appreciated you all talking about. And I think that's something that as we have the discussion in the greater population, it's better to have. I know the other part is we often hear the press and other folks talk about nurses as if it's, you know, the easiest thing in the world to go find a nurse these days, right? You know, how can you just hire like 800 nurses? It's like, well, that would be lovely. But I think one of the things that I maybe wanted to ask a question about is the connection to folks who are in the pipelines to becoming a nurse, right? So those folks who are in nursing school or in nursing programs at colleges, and their ability to connect into some of our school-based health programming and services that we can offer.
I can certainly speak. Oh, go ahead, Adrian. Yeah, no, go ahead.
I was going to say, as far as specific to the nurses in the building and the school-based health centers with the health department, we do have partnerships with all of the local nursing schools in the city of Cincinnati, and those nursing students do rotate with our school nurses for their clinicals. So they are getting exposure to what a school nurse is and what public health nursing is. Our nurse practitioners also do clinicals with nurse practitioner students so that they have the ability to see that side of being a provider and being part of public health. So we work closely with those entities, and our director of nursing at the health department is on the board at for the School of Nursing at Xavier. So we are really involved in promoting you know, the school nursing and public health nursing to those students, so they're not only thinking hospital.
Yeah, I was just going to echo the same thing. We do train nurse practitioners in our school-based health centers that Cincinnati Children's operates. I'm not sure, and then obviously the health department has a large number.
So do all of the school-based health medical partners. They have relationships with a variety of providers of education for nurse practitioners. There's a significant demand for the opportunity to work in a school-based health center and do the kinds of activities that you would do working in these primary care provider offices. So all of our partners, we see a significant number of students trained, and actually it's a great recruiting tool for the school-based health centers to attract other people to work in the school-based health centers upon graduation.
As I say, and I think that's a tremendous part about the fact that we're not operating in a separate silo, right? That our programming works to benefit from all the resources within the city, as well as provide opportunities for those folks within the city who want to be nurses, who want to work in a school to grow. I think the other part to it, and I was just thinking about this, we have some of our health programs as part of our career tech, that these are also great experiences for them to see what a nurse does, to have the experience to be exposed to a profession that they may have an interest in. And I know from going out and talking to some of the students there was a number of students who were going into nursing programs at like, you know, College Blue Ash at UC and others, but the fact that they know what the nurse does, that they've been exposed to someone, that they want to care for somebody because of their experience with having somebody who's a health professional, right? The student described in the example where, you know, her life is saved, she may now value that role of a nurse, and that could be something that she aspires to be. And that's the part of it. To me, it's the holistic picture. It's not just about what do the students get from it, but it's also what can they grow into becoming and to do from it that is really inspiring about what we do with our school-based health centers.
I'd like to add my 2 cents from a standpoint of the health checks for our young people, but also I feel so strongly if we could continue to do even more vision testing, even more deeply, more comprehensively. You want to change the way that we have an achievement situation. I know that in some areas, I think it might have been in this presentation, when we do the vision tests, that 70-some% of the children and teenagers need glasses. Now, I'm sorry, as a former teacher, if that many kids need glasses, that's going to be a problem every single day that you're teaching. I'm interested too, and I know we have to close out, but all the things that you've said, and we're not going to ask the treasurer specifically about this, but the vast majority of what you outlined is stuff for which we do not pay as taxpayers through Cincinnati Public. How do we assess what we do pay as part of this partnership? I think that's important because we could not do all this, nor should we, because we don't even have the ability. But that's when we reach out and we do this coordination and collaboration. Treasurer Wagner?
So off the top of my head, we pay for the LPNs because they're our staff. We pay for the city nurses under a contract with the city of Cincinnati. I think this year's budget was $5 million, something like that. And because the school health centers are in our buildings, we're paying for utilities.
Overhead.
Right. Right. That's all I can think of at the moment. And I don't know.
Can't think of any other answer.
Mm-mm.
Pretty good money spent. That's
The school-based health centers startup and operations are, the initial startup for the majority of it was paid through Interact for Health and some contributions from Deaconess Association Foundation, but it was like $30 million was invested in school-based health centers. They also include startup salaries. The funding right now for the school-based health center staff is borne by the ability to bill, and organizations such as Children's also contribute on a regular basis, like between $50,000 and $100,000 a site, supporting staff salaries if the billing is less than what it takes to staff that school-based health center. The ability to serve some community members, and they are not, for the most part, seen during the school day. They come before school, or they have hours of operation that go a little bit longer. And those are only true of the ones who have an outside entrance. You don't have a bunch of people from the community just roaming through the schools at a school-based health center where it's not been specifically designed to do that. So I wanted to kind of reassure people that the people in the community who are being served, it's places like Academy of World Languages where it's set up and it's a separate situation.
Thank you. It would be really neat if we could get a comprehensive financial picture that would tell a very interesting story on the return on investment.
Exactly.
I don't know if it's something that we can work with Angie on, or would that be okay? Hi, Marilyn.
Very helpful. We do, we have, before we sign off, I know everybody here, I think almost folks up here know that one of the great funders and gatherers of dollars is Francie. And without Francie, who is now recently retired, there would not have been those 30-some million, and God knows what else he's done. But then we also have, of course, you know how I feel about the Good Doctor, but I won't go there. Besides that stellar staff there at the table, we also have, I know somebody that everybody, when you appeared on the screen, they thought, oh my goodness, it's Marilyn. I thought it was like some major star. So I know people at least hear your accent before we sign off. So tell us something smart, like how good your grandkids are or whatever, or any other ideas you have about what we need to know.
Well, I just wanted to provide a reminder that the Community Learning Center model has been key to the development of the partnerships, and that the school-based health centers have been a great recipient of that. So thank CPS so much. I feel like that students have gained so much in the years that we have been in partnership. I did also want to say that as a reminder, the health department and CPS have been partners with as school nurse model since 1930. So together, CPS and the health department in the city have been working on addressing the unmet needs of students for many, many years. Thank you guys so much. I loved every minute of working with CPS and at the health department.
Thank you, Dr. Crampton. Thank you, panel. Any last comments or questions? I know we need to move on, but I feel like we got the A+ team today. Appreciate it. And again, we learn as much from our assets as we learn figuring out what we don't have. And I mean, I feel invigorated to get busy. Thank you so much. You bet. Thank you. Wonderful presentation. We'll go to the next item. We'll go to our treasurer for number 2.
So I'm going to pass the mic to Mr. Ashley since I just got to read the presentation. I wouldn't do it justice. So do you mind?
No, that's fine.
Thank you.
I apologize for the late time in getting this out.
Kevin's been very, very busy trying to keep our auditors happy because they're at the very end of the thing, and it's been a crazy week.
Definitely. So Rob, I'm going to start with the benefits cost. Yeah. So Mike and I kind of worked together to give some overview information here. This was a request from Ms. Bolton. So we were just putting some information together, and we can build on this going forward as well. First slide. So this just gives you, in terms of our budgeting for fringe rates, how we break that down. In total, it's 35% of the salary amount. 14% is the retirement contribution employer share. The 1.45% is the Medicare contribution. And you can see workers' comp. And then as far as like the health benefits, life and dental, are about 19% is what we build into the budget. The next slide is just a breakdown of what we have entered into the system in terms of a budget. You can see the combined total on the right is, this is just this is excluding the retirement and Medicare piece. But the medical insurance, a combined total of 69 million, life 800,000, dental 3 million, workers comp 4 million. So on the left, it breaks it down between certificated staff and non-certificated staff. And then also general fund versus all other funds, because we do pay some salary and benefits out of grant funds, food service, that type of thing, dining services, I should say. Yes, I always have to remind myself.
And Kevin, can I just add something? So all the budgeted the percents in dollars are based on historical spend because we're self-insured. And so it's reviewed annually to set the rates.
What does it mean, just like self-insured?
So we don't pay a medical insurance premium that's the same every month. We pay the bill, whatever the claims that come in. Could be both, depending on what's happening in the world. You know.
And we do have stopgap coverage that protects us against catastrophic claims, multiple catastrophic claims. I'm sure Dan could speak more to that. But the next few slides actually come from a report that Mercer, who is a consultant for us, that looks at our benefit costs. And I think they work with the contract that we've done with Anthem, who manages our system. So this was what they provided for calendar year 24 in terms of projections. So this slide has medical and prescription projections, and their total here is 77.4 million, which is pretty much based on historic costs. Next slide. Again, for calendar year, so we always, one hand we're doing calendar year, another hand we're doing fiscal year, but they're, again, around that 77 million. And I think part of your request, Eve, talked a little bit about employee contributions. And so this is what they estimate in terms of the percent of that cost that comes from employee contributions versus the district. Next slide. Just included this for some perspective in terms of, yes, the participation rates in the different components of health insurance, the HMO plan, the POS plan, the high deductible health plan. So you can see the POS plan is really the traditional plan. And then within each bargaining unit, there are some nuances that are available to those employees depending on the bargaining unit. The next slide just talks a little bit about the funding rates. Again, within the bargaining units, there are tiers. The tiers are primarily employee plus a spouse, employee plus family. So this just kind of shows you for 24, I'll use the traditional, it's $2,300 a month or a year for that employee plan. That's just kind of the number I pulled out there. So I think that's all in terms of just giving you this general information.
Recruitment and whatever. These folks that were just here, I mean, one of our guardrails is the whole child, and one of our goals is chronic absenteeism being reduced. I mean, these are important things to do. I mean, if the public sector didn't offer good benefits, there probably would be nobody left in the public sector.
Right. So, the Parthenon study that was done back in 15, 16 recommended increasing the employee share because we have a pretty rich employee compared to corporate America. Or the rest of the industry. And so I just did a quick calculation. The employee shares represents about 21% of the total nut of the 77 million. So just something to keep in mind. I'm not suggesting union members that are in the room. I'm not suggesting anything at all. Oh, we got Miss Imbus down here and Miss Emily over there.
But that is low from the standpoint of a percentage in some parts of the real world. But I mean, we've made a concerted effort, and the unions have been adamant about keeping it as low as it. But no, Jen did not say increase it or anything. We're not allowed to even think about that.
Repeat that one more time in case Ms. Sellers is listening.
There. Okay, thank you. Questions, benefits, comments? Amazing. I'm just so excited about it. All right. Next is I think that's you too, Carol.
Yeah, the certificate of participation. You just kind of wanted, I believe, to identify the buildings that might be eligible for that type of financing. So what I did here, I took the facility maintenance plan draft, pulled out the items that related to buildings that are already encumbered through a COPS financing.
And you all have been sharing that with us for about 3 months, particularly almost 4 months now. I appreciate that. And now you've done the next part of our homework for us.
Yeah. So on the first slide, these were, because all of the encumbered COPS that we have, all the buildings related to that are primarily high schools. I went ahead and identified those separately. I don't know if that might be the route we go in terms of these would be the facilities that would be encumbered. Certainly, we can do work on other projects, even in those historic ones, you know, where the high school was the primary and that was the one encumbered. There were projects like for doors and windows that affected 25 buildings. So just because we do work on certain buildings doesn't mean they're all encumbered necessarily.
Just always miss that meeting, that if we're doing something like a security piece or moving doors rather than some massive, does that disqualify us for that building for further COPS? Or is it a percentage of the amount you spend or what you spent on?
I'm not sure. I will have to consult with Brenda on that, but I kind of got the assumption that doing windows is more of a minor thing and it wouldn't prevent us from doing a COPS. But we would need her advice on
That
that.
would be great if that's.
Yeah, and maybe to your question, actually, you know, in theory, the COPS, when you're encumbered by a COPS, it's for a percentage of the value of the building, right? Like it's not per se because of those specific tasks that's being done on the building, but it's the value that the building has, right? So in some ways, it also is about like how much of the building have we said we're using as this asset that the COPS is built upon, or that it's encumbering upon there, right?
So I believe in the past when we've done a project and let's say we encumbered Western Hills campus, the value of that encumbrance was for the entire property.
Yeah.
We only did a portion of that dollar figure work on that building, and we were able to then use that additional funds for things that affected multiple facilities. But the encumbrance, the legal encumbrance related to the issuance, I believe, only related to that one facility.
You're talking about the Gamble project?
Yeah. Because we did some work, I believe, on LEAP.
Thank you. We use the money to do elevator or and some roofing, I think, for some of the smaller buildings. So it was the project was Gamble and Cans, because those two projects happened at the same time. But then we used the funds to do like 3 or 4 other buildings that had minor repairs. So you're saying the other minor repair buildings weren't encumbered, just Gamble?
I believe that's the case because of what we've received from Densmore related to currently what is encumbered.
Yeah. And then kind of the second point to that, though, and I think this is where I raised some concern or have some angst on using COPS, is that we already have such a large amount of money that we are paying on prior COPS. And as we go forward, is that something that we sustainably can manage and continue to do, given that we are already saying we have to take money out of doing something else?
Doing a COPS issuance would increase the amount of money we're looking to carve out of the budget, right?
For 25.
And how the length of the COPS?
Yeah, okay, but I'm saying, starting with this budget we're trying to come up with.
Yes, depending on when you do the COPS issuance, yeah.
So I feel like I know it, and then we leave, and then I come back, and I'm like, where are we at again? So now I'm not a fan of COPS because I think of it as putting a Band-Aid on something that we're not really curing. We're just moving the debt down further. So, and I'm also confused. I'm not clear. Let me put it like that. I'm not confused. I'm just not clear on the answer to Brandon's question, because I understood the COPS, and I did ask the question about property versus a building. Could we use that for COPS? And I'll ask that in a second. But if we are using a COPS against a building for specific things to repair on other buildings, I'm asking this question, right? So if we use the COPS against, I'm going to give this as an example, against Gamble, but we repair Cans windows, I guess I'm a little...
Gamble's value was high enough to cover the risk to the borrower.
Mm-hmm.
So that we could use the money to do smaller projects. We just had to disclose what we were using the money for. But Gamble's property was valued high enough to compensate for the risk of borrowing. That make sense?
Yes, it does. That part of it makes sense. I guess where I'm confused is it's tied to a particular project at another school. So that project can't be for that school anymore, but we've encumbered that money. So we can't do windows at that school, but other buildings need windows. So now we've tied two schools for a project at one school, but other schools need it. And we can't tie any more money to the other buildings that need it, that may need the same thing. I guess.
Dan, you wanted to say something?
Yeah, the property, it's not a mortgage. Districts aren't allowed to mortgage, but it acts just like a mortgage.
Correct.
So the property just secures the bank's loan essentially to us. That's all that's happening. There are some special programs that are tied to how you're going to use the money, but for the most part, COPS are. Just think of it as a mortgage essentially.
And I'm very clear with that.
Yeah.
So that's really not where my confusion is coming from. I guess I'm really stuck on the fact that we're using buildings to cure a deficit, and we're not really curing the deficit. We're just borrowing money to manage the deficit, in essence, right?
We're considering borrowing money to do something that's not covered in the operational budget already. It's not, if it's something that's going to be recurring, like facility repairs is going to be recurring every year, a different building every year, but over a 10-year period, then you want to do something longer term. COPS are short-term borrowing projects. You have to, in the IRS forces you to pay within 3 years, right? You have to spend the money.
That's right.
So COPS are only good for short-term projects, not long-term recurring expenses.
Yeah, I get it. And that's good. I think, so the buildings that are listed there on slide 2 are currently not in a COPS.
Correct.
And do we know a value of what those buildings, or what we would be eligible for potential COPS? Or is that what we're talking about?
Yeah, probably not.
Okay.
Yeah, we're not there yet.
We kind of have to tell them or ask them to go figure that out. Right now, we're just trying to figure out which of the buildings, if I could, kind of piggyback on this. This is new for me. I am actually a big fan of COPS. As we position ourselves in a couple of years to go out to the public and ask for big money. I think there's this bridge we have to get over first. So you just said that we use the assets of a particular building, like was it Gamble? But the value of that building allowed us to use COPS money on some other building.
Because it was included in the project plan.
Yes, total project plan. And when we asked for the COPS, we had said this other school will be part of it. It's not like
Right.
good, let's tag it on because we got
Correct.
something left. It was part of the overall concept. Okay, that's good. That helps me a lot. Any other questions, comments? We got a next sheet that shows us the potential eligible building, so high schools and elementaries.
Right.
Yeah, so these were, one of the things the treasurer and I talked about is for this list, for this purpose. We only included those facilities that are in the facility maintenance plan. I want to say that correctly. The facility maintenance plan. So if you see a school not listed here, it may be that there wasn't anything included on that plan. So just so you're aware.
Like cans, for example.
Right.
Cans is either encumbered along with the Gamble or it was not on the facility repair plan.
Right. Or there may have been some very minor things like security systems. That was $1 million cost, and that may have affected multiple buildings. I may not have included it here if it was very small for that type of thing.
Yeah.
So again, this is a draft. I'd like to get with Mr. Burkhart to make sure we're kind of on the same page. We were just trying to get you some information for today.
And my approach to it, just to get it out there, I am not as hot to trot about the COPS for maintenance or repair. I think there are major physical things that have to happen in some of our buildings in order for us to facilitate growth and consolidation and ultimately save some money, or to indeed improve our rating, so to speak, where we have, let's say, low enrollment or whatever. I see the COPS as short-term COPS, as initial COPS, or this next COPS, as being able to be used for that. Even that third Montessori high school, which we need and have to have. But we can't afford an actual high school from the ground up. No, we can't afford that. But maybe there's other things to do. So that's good. This is very helpful. I learned a little bit about the overall plan, and then you could use it. And I think that we leverage the assets we have. Anything else? Yes?
Wait, I do have a question.
Oh, sorry.
No, you're fine. I mean, she's so giddy today. I'm like, oh my God, this is kind of scary. Did we get an answer to my question around utilization of land ops? I know it's not a building, but it's still an asset. So when you said asset, I'm thinking like we've got a lot of land, and it has a value. It has value when the auditor considers it value because we pay taxes on it. So I'm wondering, can we utilize land as well?
I don't know. I'll find out.
Thank you.
Yeah.
We're talking about acres, so I'd feel comfortable.
13 acres, I don't think.
Yeah.
Sounds a lot.
I never got an answer.
So Dan's going to find out for us?
Yep. Thank you.
Oh, okay.
That
Now
might
we
increase
are
our,
next.
that might make me feel better. We just top 10 acres. And
So you're saying, can we use vacant land as leverage in a COPS?
Correct.
Vacant land that we own, but not necessarily associated with a particular building.
Right.
Is it
Like mine old.
Yeah, mine old,
Jacob Center has a lot of land over there. We've got a lot of land that has value. It's significant value. I don't want to sell it, but
13 acres in Avondale.
hey, no, that's my neighborhood.
Okay, we're ready for the next one? Negotiations timeline?
Sure. Thanks. Good morning.
Good morning.
So I think the ask was to give a little update or kind of summary of what the timeline is for collective bargaining negotiations. The district's contract with the Cincinnati Federation of Teachers provides that the contract's effective from July 1, 2021 through June 30, 2024. So this June, that contract expires. And the contract specifically says that the parties agree to start negotiations by December 1, 2023 and conclude by March 31, 2024, unless the parties mutually agree to conclude by April 30, 2024. So that's the language, and the idea is, I think, to try to have a resolution to the negotiations before the schools break for the summer. Teachers leave for the summer. It gives CFT the opportunity to have the contract ratified. AFSCME Trades, Local 20, and CFOP are all on the same timeline. Excuse me. Contracts June 30, 2024, and I think all parties would like to see, would like to have a goal of completing negotiations before the last day of school this year. The CAS contract is very close to the same timeline. It has an expiration date of July 31, 2024, so just 1 month later. And again, I would think that CPS and CAS share an interest in having an agreement before we break for the school year. Kind of this pre-negotiation period that we've been in, I think the unions and certainly CPS have been putting together negotiation teams to represent the district and for the unions to represent their members. We held a 2-day training last week that was two half-day training that was facilitated by Lou Manchisi of the Northern Kentucky Labor Arbitration. They have like a small group down there that studies and actually helps with labor negotiations. Lou has helped the parties many years previously and provided trainings. Every union participated. Lou split the participants up into teams. You weren't necessarily with members of your own team. You weren't necessarily negotiating for, for example, I was on a union team and my good friend Emily was on a management team, and we negotiated against each other in solidarity. It was very positive, very good experience, I think. But I think it was well reviewed. Also, in this sort of pre-negotiation period, we've received information requests from the unions. That's very typical kind of pre-negotiation. I think we've gotten some information back to CFT. I have some information to send to AFSCME very shortly here. So we're gathering that. Both sides kind of convene with their constituents. The unions, I'm sure, are reaching out to their membership to understand the priorities that their members have for these negotiations. And CPS, of course, is talking as a team and with the board to ensure that CPS's teams understand its priorities. It will be a busy third quarter, I think, as the CPS and its union groups try to get to resolutions and agreements. And I think, again, I think there's a shared interest to try to reach contracts by the end of the school year. I didn't answer any questions, and I know we've got some union folks here if I missed anything.
Any questions?
Excuse me.
Board members? Nope. I have one comment. The president, you have. The board members did receive a memo from you, and I appreciate it. And I would be anticipating that in January from that memo. I would think that kind of helping educate us as the kinds of negotiation styles and models there are. Probably, I would anticipate that the board will want some degree of discussion and education further, and ask questions about what people might be thinking would be a good approach. So I think that would be useful. But thank you for that memo. If there are no other questions, this is a full language too. This is not a reopener. That's correct.
All the contracts expire on again June this summer. So yes, it's the whole contracts are open for negotiation.
But that does not mean that the contract language gets to go away. It just whatever goes away or is added is a negotiated item.
That's right.
None. All right, let's move on. We have the financial data, and also, Jen, as soon as we get that done, we'd be ready to talk in terms too of the redesign. I would like that before we get to some of the other discussions.
Sure.
Monthly.
Yeah, so I'll just give you a quick update. If you could go to the monthly financial combined graph, it's in the board docs already. But really, in a lot of ways, it's similar to what we talked about last month. Slide 4 has the cash balance over the last 3 years. Last year was at 150 million for the general fund. This year, it's at 98 million. So obviously, it's down a third. What we talked about was the amount of spending at the end of the fiscal year on slide 4. Sure. Yeah, not that one. We like throwing him wrenches every time.
He can handle it.
Yeah.
Just have to make sure he's awake over there.
Right. And then in terms of revenue, which is slide 5, this year, fiscal year to date, 271 million versus 267 last year. Our budget for the year is 596, so we're about halfway there. 45.6%. Last year was 47%, so pretty well on track there. That's the cash balance slide. And then we'll skip, there's the revenue slide. And then the next one is revenue by source. So you can see all of the categories were up slightly, except for other financing. Next slide is.
Is there a reason everything slightly? Time of year or what?
So in terms of taxes, you know, for the first half of this year, we expected those to be pretty flat. Now with the reappraisal, we've got new values, and we're going to be updating, you know, what we'll see for the fiscal year. Optimistic, we'll see a little bit of a bump there. We build a bump into the forecast. Hopefully it'll be a little bit beyond that, but we'll see. State Foundation is up a little bit in terms of, obviously we expected around $20 million additional from the Fair School Funding Plan. So at this point, we're about $8 million up, having gone through 5 months. So some of that will change based on enrollment, and other things like valuation can affect that as well. So, and then for all other, again, some of that is timing, some of it is changes in, you know, mainly timing, I will say. Next slide is expenditures. Oh, I think back one. There you go. So again, as we've done the last couple months, trying to show with the hangover from the school-wide pool, just to see that it's kind of pretty consistent over the 3 years. I think once we get through December, it'll be more comparable, because December is when we moved things over last year from the school-wide pool remaining to the general fund. So hopefully
Will we
that'll.
have a funeral service for school? I'll bring food. I'm still on this committee.
Sounds like a plan.
Got it.
So next slide just breaks it down a little bit in terms of salary and benefits versus other expenditures. Obviously, salary and benefits are the hugest part of our budget, and then to the far right showing that budget. So $479 million of our budget relates to salary and benefits for the general fund. Next slide is unallocated expenditures for the general fund, and the main thing we're just showing here is where we're at in terms of what's actually been spent, what's been encumbered, what's committed for salaries. There's a little bit remaining for transfers, and then what's remaining. So at this point, it's 33 million, or 5% is not encumbered at this point. It's budgeted but unencumbered. And comparing that to last year, it was 51 million. So I think overall there's been more of an effort to get those things encumbered. Next slide is ESSER, and I'd like to preface this with, this is all of the grant years combined. What is unallocated at this point, and it's about 14%. So I know there's a concerted effort ongoing to, you know, make sure that that continues to progress, since we are nearing the end of the project. So just to show from September to this month, that unallocated went from 39 to 19 million. There'll be some other changes with salary reallocations and repurposing, that kind of stuff. But
So in mid-January, the leadership team is going to go line by line through all of our state and federal grants and reallocate vacancies that have not been filled. That's what caught us last year. We had a lot of vacancies that were in state and federal grants. And so we're going to make sure that we reallocate it and repurpose those funds so they do get spent as intended.
And then just quickly, I have 2 slides on preschool. The tuition assistance summary, as we mentioned before, we're calculating at 3%. In terms of, at the end of November, there were 987 students who received some type of tuition assistance. The number of days were lower fiscal year to date. I'm not exactly sure what the nuance is there. It's something we can check with early childhood on. The total number of preschool students enrolled at the end of the month was 2,021, which is pretty comparable with the prior year.
So the 3%, so you remember that we use a cost of quality for tuition assistance per pupil. And that value gets increased by 3% per year to keep up with inflation. And if you recall, in the CPP budget, they increased it 10%. And because that was not part of the master agreement, we kept ours at 3%. And so now we have a difference. Just wanted to note that. That's what he's referring to at the top of that slide.
I could ask, what's the status based upon our sort of combined meetings from 2 weeks ago regarding the documents? I don't know that the board has seen any new documents or.
Preschool Promise.
Yeah.
Yeah, we received a revised draft from Preschool Promise earlier this week. The superintendent and I reviewed it yesterday. We're scheduled to talk to the treasurer also. And I think there's a meeting next Wednesday between the two staffs already scheduled with CPP to try to work out some of the differences. That's the status.
That was the agreed upon process, was that the two administrators are going to get together and talk. That meeting's next week.
Mm-hmm.
So on the next slide, the red at the bottom, I did do a calculation if we were to use the 10% versus the 3%. So that's what that's showing at the bottom. Otherwise, nothing new. You know, we've known changes in tax revenue. We will see a change for that come January and February. But again, nothing kind of out of the ordinary with that slide.
Mm-hmm.
And then I think Mike will talk about the grants.
The grants? Nothing? The grants? Go for it.
Okay, Rob, if you can keep scrolling down a couple slides there. One more. Okay, so this is just kind of the grid for state and federal grants. We're in month 5 of 15 for this current year grant cycle. Our goal is to be about 28%, and we're at 35% for public school grants and 40% for non-public. So doing really well at this point. If you hit the next slide, Rob. There it is graphically. You can see the dark bar is current year. So we're trending well. That's good. We haven't gotten our carryover yet. So that'll put a little bit of a wrench into this, but we'll start seeing carryover in the next couple months. And as Jen said, you know, we got those meetings set up, you know, to go line by line to look for underspends and reallocate.
The challenge with carryover is we get it in January, or use time frame, but you have until September or to June to encumber it, and then September to pay it out. So you have a very short window of time. So we're trying to get everybody to pre-think how that money is going to get spent so we can hit the ground running. Typically in the past, we get the money and then everybody starts working on their budgets. So we're trying to shorten that frame.
Next slide.
Well, just one quick. I know we talked a little bit about it, I think the last time, but it's just the difference between the percentage meeting the spending goal between the public and non-public, and just, you know, I know we're improving. So it's like constantly a goal to keep improving that.
Yeah.
But is that kind of the goal, is to have those closer in line so that everyone's kind of meeting their spending goals so we stay on track?
Yes.
It is, yes. And if you look in the big sheet, right, there's and if you go back to that slide, the number of grants, you know, there are 29 separate individual grants now, and some of them are really small, some of them are a couple $1,000s, and some of them are as large as Title I. So each of those has a different strategy that we try to get to. But at this point, yeah, the higher the percentage we can get, the better. We know we're going to have to absorb the carryover. Go ahead, Rob. Let's see, next slide. This is just the title summaries. So we've committed to kind of breaking out the different flavors of title, from Title I to Title IV. You kind of see where those are at. Most things are looking pretty good at this point. Title IV, we have been having some meetings with the budget owners to work through that to get them back on track.
We have a new employee over Title IV now, so getting her caught up and moving.
Yeah,
Can you explain, there's a significant amount of money in Title II and IV. What are those funds for? Like, what are those grants for?
Title II, high level, it's kind of improving teacher quality. So we use it for PD, some teacher recruitment things can be in there sometimes, but it's basically getting better teachers, keeping better teachers. Title IV is kind of a mismatch. A lot of it right now is in kind of social emotional learning and positive school culture stuff.
It's for safe and drug-free schools.
Yeah.
Title II used to be about class size reduction and professional development, and that they've dropped the class size reduction. We used to use that to remove splits because we would try to combine classrooms to save money. But it's mostly just focused on professional development for the certificated staff.
And so that to me, what I look at that like, wow, we're not professionally developing our staff. So there's a significant amount there that is to me concerning. And why is it still there? Why are our staff not able to use it? And then Title IV, is that a direct service to kids? Title IV money?
So, and let's go back to Title II for a second. There's 2.5 million budgeted. We've already spent half of it. And we're halfway through the year. So we're chugging through. Okay.
I can see. I got you. But Title IV, is that a direct service to kids? Is that those fundings would be directly impacting kids with programming or personnel?
Yes.
We're only at 18%.
Yeah, most of these you can't use for any administrative costs. You get some indirect costs to cover like the time that the finance department uses to manage the money and all that kind of stuff, but you can't go hire school-based administrators with it, with these funds.
And most of our
Or
grants-
central office.
Yeah, most of our grants have between a 5 and 10% administrative allowance, right?
Okay.
So that's
But I'm just confused why, if we're only at 18%, we're halfway through the year. And I understand that for Title II, but that's one that directly benefits our kids, and we're only at 20% of the spend. No, that's just, it's not about the administrative costs. It's like there's $2 million that's sitting there that could benefit our kids, and we're not. We don't even have a plan to spend it.
So there's a plan.
It's not being implemented. Why are we only at 18?
We are working through that. Yeah. So there's, I think there was a lot of 6 PBIS school social workers. We think were miscoded during the rollover, so we're going to go back and reclaim those funds. So Mike and his team are working through those details. So we'll provide you an update next month.
Is it anticipated to go up 32%?
I can't say that until we finish the data analysis.
Well,
just an eye out for next month. but yeah.
Okay, well then I'll ask again.
Yeah, keep an eye out for next
Okay,
month.
okay.
And we'll see how we do.
For sure.
And this is the kind of transparency we want.
Yeah. I mean, to the public, we're 18% of that spend. That's very low, and that's a direct impact to students. So, can you tell me what schools would be the Title IV schools are basically the same title? They're all of our title schools, or no? There's specific schools.
It's not. I don't think it's even school based. It's programmatically based. Like those PBS social workers have a variety of different duties they do across the district. So
And some of these help fund the satellite programs.
yeah, like the Title I neglected and delinquent. Those fund the satellite programs.
Thanks.
All right, keep
All right,
going.
Rob, next slide. All right, so this is the famous ESSER block graph. As you can see, we get closer and closer to being fully spent out. So I think Kevin talked about it a little bit, but you can see
We're getting there.
the 2 tall bars are the entire life of ESSER, and then the 2 smaller ones are current year. You go to the next slide, Rob. Again, this just breaks out the ESSERs. All the things that are gray shaded are closed and done for. The amount did go up slightly this year, so we did get some extra. We got a little extra money for homeless. So if you've been watching the numbers for this year, and you still see it change slightly, so I got a little extra money. But we are spending away and continue working on that. Make sure we get it all spent.
Could I ask a real quick question? I think we talked about it a couple months ago about whether or not the 120-day rule pertains to ESSER that has pertained to other funding over time. Do we get to look into whether or not it's a 120-day?
The 120 days is from June 30 to September 30. That's not 120 days. 90.
My recollection was that, at least I think this was set up in Columbus.
So you're talking about this,
Even though you have some deadline, there's this 20-day rule And we asked about whether or not it was pertained to ESSER. I mean, they didn't know either, the folks that were presenting.
I'll look it up.
I think it only applies to Title I, but we'll
Please
verify.
check if you want. That's great.
I believe that is the last slide for the grants.
Any
Any other
questions for the folks? Mr. Craig?
I was just gonna say, to your point, Joe, the September spend is 120 days out from June 30th. So the September 30th would be 3 months behind
Yeah.
June. So I think it's in line with, it would likely be in line with what that expectation is. You still would have to document what you were going to spend it
We're
on
gonna do it.
in June. Yeah. And I want to just also say, I think it's great that we, you know, last year and early part of this year, we were seeing that transition of making sure things are getting spent on a timely basis, making sure things are getting encumbered. And so I want to also give a lot of credit to the folks who have been working hard with individual schools to get them to understand the process a little better and make sure that they're also allocating the funds in an appropriate time frame that they're actually paying attention to and not waiting till the end of the year to try and budget things in to spend. Because I know in the past, it's been one of the things that we've heard from you all is that the reason we don't spend funds is because everybody holds on to it till the end of the school year and tries to spend it all in the last day. So I want to, commend the effort that that the treasurer and the team have been doing to make sure that folks are understanding to go ahead and budget things and encumber things so that we can get the work done and really provide the resources that we are actually budgeting for to our students.
Thank you. And it really is a group effort between all the budget owners and our team. So.
Thank you very much. Jen, you want to just give us a
Yeah, so I just
intro to this idea?
I just passed out the last treasurer's report because the board is really the customer of the treasurer's report. As we've been trying to computerize it, instead of having somebody type in a Word document all the information, and it takes ungodly amount of hours, we've been taking data out of the system with an extract to electronically create the treasurer's report. So it's turned into a not very pretty one, and so we have an interest to redesign it. What I would like to ask you to think about is what's on the report that information that you don't need, you think, because we need to save space, and is there information that you need that's not on the report while we look at redesigning it and making it more professional looking. So, and we can talk about it next week if you like, or next month if you like.
I was gonna say not next week.
It's on for quick comments or initial suggestions. I mean, I think this has to be somehow part also of we try to move towards some sort of, we already have kind of a modified consent calendar or whatever. But as we begin to think about that, possibly, I mean, it does seem somewhat archaic. The other piece is, I think, the life of the particular amount of dollars. I mean, that's always confusing to me, is that, at what stage are we in this money? How many more years do we have on this particular contract or something? Just sort of the lifespan of it is of great interest to me. Because it seems to be where I ask a lot of questions.
We're trying to teach the users on their KPIs to say it in a sentence instead of a theme paper. So, because that's crowding everything, right? And so we're trying to get them to just share the measures that they're trying to do instead of the justification behind it all. Some people are a little wordier than others. So we're working through that as well because we're trying to add that information, it's squeezing down the space on the form and we're having to go to bigger documents so that you can actually read them because the fonts are so tiny.
And so I do agree that the page got bigger and I was like, oh my gosh, I need special paper to read it. And so, to print it. And so I'm going to give feedback for sure.
Yep,
you know me, but
yeah.
I'm always interested in the vendor, less the contract amount, what department it's impacting, I do kind of glance at the end date. The fund amount, probably not, but I look at the KPIs because that's just me. And I want to make certain, and I don't know if this is even applicable for this, but it would be really nice if it could tie into how does this benefit a goal or the guardrail, or how does this be like what I'm looking at it, and I always discern, okay, this particular department needs this contractor for this thing, and then I'm going to ask you what was that return on investment and what was that benefit the next month, because that's how I think. Everybody doesn't think that way, and that's perfectly fine. I'm even fine to get some of this stuff electronically, but to have the big things in a column that and then you can click on a link for the rest of it, because I know it is a big piece of paper and it does get very lengthy, and we all don't look at the same, we don't have the desire for the same thing. But that's just me personally. If you need to make it compact, and when I see this at the board meeting, I'm like, oh my God, long piece of paper, and then I have to go down on the screen, and it's very, very small. But that's what I'm looking for. I'm looking for what department is requesting this money. Who is this particular vendor? Is this? I'm interested, even if it's a local vendor, minority vendor. I don't know if you can color code that so that you don't have to actually put that on here. It'd be nice to say like, hey, purple is minority and female vendor. I don't know, but I'm just giving you some suggestions to make it a little easier. But those are the particular questions that I ask and the things that I look for. Okay. But again, everybody doesn't do that. But I'm happy to give you more feedback as soon as I process.
Yeah, I have time. Yeah, that's just introducing the idea.
Yeah, for sure.
I'll share just two quick thoughts, and then, again, I think this is something we always can keep talking about as we go forward. I think, to your point that this is a document for the board, I also think that this could become a document that you all utilize to ensure that everyone is getting information in on timely, and that things are happening with regards to if there's a contract out that's supposed to be being billed out, is it being billed out, right? And in some ways, to me, that is of using the tool you already have in a more effective way, which I think is something you all can do. Like I trust that you all will figure that way out, and we've been doing it a lot better each year, in each month. But I think the second part to me also is in just thinking again about how do we get things done in a timely way so that we can be more effective and efficient with the document itself. Is that in some ways it's a question also of what is the purpose of, like, what does the board have to approve is one question, and then what does it need to do that approval, right, is part of what the treasurer's report dictates, right? Because there shouldn't be, like, if there's nothing spent on something and there's nothing for the board to approve, in some ways it's not the place for it, but maybe there's another space or somewhere else that we would have that discussion.
Right, so the for board information section of the treasurer's report, that stuff doesn't need to be approved, but it's about transparency, and it's been carried over from previous treasurers. So is that something we can take off and just keep a, like 3 times a year, give it to finance committee and it's part of the minutes?
And that's I mean, again, I don't know, and that's a good question for us to think about, to get feedback on, because I think that's the type of stuff where, to me, it's about, if the document is something that we're just approving and we need the information to approve it, then that's vital. If it's information that's just something as we're going along on a kind of, this is where we change stages, maybe there's another vehicle in which we can have that information provided to the board that may, whether it's a separate document or whether it's a whatever phrasing it is in there. I just would be interested in hearing or seeing what you all are able to put together.
I have 2 issues. One is there any universe where the board would only have to take action on treasurer reports once a month?
You'd have to increase the dollar value, my authority.
Okay.
Because one of the things I've been analyzing is the number of then and nows are usually caused because people think they have a PO, but it hasn't yet been approved. And so they start working. If we increase that authority and I can approve, but keep a transparent record going so it's still out there, we'll minimize those mistakes and certainly put work into action faster.
Go ahead. I was going to ask the same thing about superintendent recommendations.
I think it's the same. It will allow for a lot more efficiency to have the authority increase, because I was thinking about then and now as we talk about this all the time. And what we find is that it's improved, but individuals, to our treasurer's point, they think they're following the right process, and they actually are following the right process. It's just that the time that it takes for it to get through, they think it's gone through an approval. So in terms of the superintendent's recs, I think it would work the same way, in that the authority that's given generally, it was given to both of us at the end of the year to operate over the summer until we come back to another board meeting. That same kind of authority would be beneficial, because we still have to list it. It still has to go through the board. It still has to go through board approval. But it does mean that some of it could be backdated in terms of by the time it gets to the board, the process has already started, which is really kind of the norm for the way that you see that work done.
So there's 2 resolutions that the board approves in January of every year. It gives both of us, each one of us, the authority to act in between board meetings. I can't backdate finances because that's the then and now type of thing. So my value would have to go up in order to avoid that. But I'm saying that we will still include it as these are the contracts that are approved this month, so that it's very transparent and the public and the board's all aware what it is. In my head, I was thinking about we could do all the undervalue contracts and just keep a running list of them on the website, so anybody can see what that is. Since I'm not required to have board approval for that, we can take it off the treasurer's report and just keep a running list on the website. So I would love to go to one meeting a month.
Well, I would hate to misinform you of anything, but so would the board. But I'm just trying to figure out how we can also do the public's business, and how we can, and I don't know if we're in an environment in which giving anybody any more authority is where we want to be, but we do want to figure out a way of having the ability to do that. If general counsel can help us figure out what actually is required by law for us to do or not do. You know, whether it's the size, it's one thing to say it's the size of the contract, and then here it's like, okay, who are we going to employ? I mean, this is an important discussion that we can have, which we didn't plan on having today, but at least it gets us started. Did you have a comment?
I do. My only concern, because I would like, let me just tell you where my annoyances are, and then if that's a fix. It annoys me to have additions and revisions the day of. That is the most annoying thing, because I've taken my time to review it before, and then to have things on the floor that I'm looking at that I may or may not have questions about, to me just doesn't seem very responsible on my part to be able to look at it and get all the information. Whatever we can do to make the process more efficient so that we don't have that, I'm all for, because I want to be helpful to you all, so that I do recognize that things come in at the last minute. That sounds like an awareness and an education issue to me, to educate the teams and the staff on how to properly put things in, but maybe that's not the only solution. But I'm thinking of the example where there was significant discussion around the Council of Great City Schools contract at the board level, on the floor. And so if would that contract, if we increased authority, would that contract have been approved at the 100,000 level? That's the example. But then some more than just 2 or 3 board members expressed concern about limiting that. So that's the example that I am concerned about, is that we would be inadvertently, as an unintended consequence, giving authority for things that board members may have significant concerns about, but then they're already paid for. So how does that happen where we're still being able to have some sort of awareness on things that we may want to have concern over, and they don't get pre-approved or prepaid for or pre-authorized?
So nothing gets prepaid for except for one contract that's written into, and that's with ABC.
Okay.
We only pay for services that we receive. So we would have time to cancel the purchase order if somebody objected to that before too much, some money might have been incurred, but not the entire thing.
Yes. But one of the consent agenda things too, we talked about it briefly, is that those things that are of concern get removed. And, or they get categorized in a different place so that you're only discussing those things and rather than kind of, which would make us have to be much more organized. I worry that it would make us have more or less transparent conversations in front of the public because we'd be kind of talking one. There's a way to do it because I know that some districts actually do that where you don't pass the whole recommendation, you separate, you approve the agenda as it is presented, except, you know, this, and that, and then those exceptions become the discussion items in that particular month, that particular meeting. But let's hand it over to the other finance committee to worry about this. But thanks for bringing it to our attention, and we need to do this. We are trying to get things reorganized as best we can. We have the last few minutes, so the last two items, I think. We do have something for January. Those 3 items are there before you. And we have some questions about ad hoc follow-up and, bless you, sorry, here's water. And then the roundtable questions. The follow-up to ad hoc is that at the end of the report of ad hoc, that both policy and ad hoc, policy and finance got assignments. So that looking forward, that should be on anybody's finance agenda as we move ahead to January. Let me ask a question of the administration. The report was handed over to the administration. Unfortunately, we didn't have a lot of time to discuss it during the meeting. It was a big meeting. How is the administration proceeding with the follow-up of the report? Superintendent.
So a few different things so far. As our treasurer shared the night of the board meeting, we have had our first review meeting to discuss what's currently in the recommendations. We've had our teams that are responsible for doing the work on it. Next week they'll come back and give an anticipated timeline for the amount of time that it will take for them to then give updated information so that we can share that with the board. Right now, you know, we're looking at like the end of February, middle of March in terms of being able to comprehensively respond.
Some interest of having anything happen this coming year. Those things would be moved a little bit ahead of mid-March, being able to tell us, right? Or
I would say yes, but I don't want to correct. That's the best way for me to say it right now, because we know the timeline we worked with. That's perfectly fine. Perfectly fine.
I think that one thing, we do have a meeting scheduled, one last ad hoc meeting scheduled. Although I'm not sure we want to keep that for the day, but I do, we agreed to, I think we agreed to sunset after we received some feedback. So one of the things I think is pretty prudent for us is to prioritize those things so that the administration knows what we're looking at kind of receiving first, with the anticipation some of those things were for the upcoming school year. And so maybe that would help also with your timeline of providing the information back, because you would know what we're looking for as a priority. And we didn't have an opportunity to adequately explain that during the meeting. We didn't prioritize those things even in discussion. So I think we gave a long 19-page recommendation report, but it didn't have, because we weren't able to have a discussion on what things we were proposing for next year. And I think that should be the priority. And I know I heard President Lindy say he wanted costs to be able to make those decisions, and we just don't have that. So,
and I was very generous. I'm the one that said, "Oh, maybe the end of February."
You were. I gave you the look, the Karima look, and you just didn't. But I do think that we did not.
But that was because people were talking about like, oh, how can you come back next week, or can you come back? And I was like, well,
no, we can't.
So, the end of I've sat here for many years with these recommendations and they don't get done. And they fall into the deep hole. I just want to make sure that we're all on the same wavelength about prioritizing things.
Well, we made it very clear that it needed to align with the budget discussions because we were wanting some of those things to happen for next year. So we didn't really we didn't have an opportunity to finish, but we also didn't have the engagement that we wanted to prioritize the things that, and we can do that in January for sure.
It's not like that's over.
So just my clarifying question, because that's not what I thought I heard at the board meeting. So what I thought I heard at the board meeting, and I can go back and look as well or for clarification. So the last thing that I thought that I heard at the board meeting was that the report from ad hoc was transitioned to administration, that administration would then take that report and prepare to respond to that report at some time certain. And then at that time, the board would determine whether or not ad hoc was going to reconvene. So I did not understand, nor did I hear at the meeting, that we were expecting anything else at this point from ad hoc.
I think you are partially right in that the ad hoc committee wasn't really due to sunset until we had finished phase one. And phase one also included getting a prioritized list of those recommendations. Part of what we were supposed to be doing during the discussion was to have the board engage in prioritizing those recommendations that we wanted. We didn't get an opportunity to do that. So we couldn't provide administration with the prioritized list of what we wanted you all for the board to be able to say, hey, these are the things that we wanted to be done immediately. We do and have always wanted some of those items to be considered for next year. And President Lindy said, well, I need to see costs. We do too, but we never got those costs to be able to say that. And some of that is contingent upon, at our last few ad hoc meetings, getting the specifics from administration regarding, for example, is it a 5 through 8 building or is it a 6, 7, 8 building? What do those costs look like? And we kind of played around with that a little bit with regard to the treasurer and Jeremy saying, we just need to know what building you're talking about. We need to, because they can pull those numbers, and they tried, but we didn't have the formalized recommendation from administration on what it looks like. And so when President Lindy said he wanted costs, that's what we were thinking of. If we were to do some of those things for next year, what does that realistically look like in alignment with the budget discussions that we're talking about? So
I'm gonna take personal privilege here, and we did agree that ad hoc would be sunset.
Mm-hmm.
We had one more meeting of ad hoc, and that one more meeting of ad hoc, I would assume we would do, 3 of us and whoever else would do what we thought we were gonna be able to do in that board meeting that long to begin with. But the report's been handed over to the administration. Nobody's wrong here. It's now a matter of the timing, but to assume that we're going to hand the report over and then we're going to say, oh, now you tell us what you're going to do. Yes, but the board has to also react or not react or do its kind of discussion. And I think it's very likely that the board might have discussion again, perhaps, but we are sunsetting ad hoc, and the report's been finalized, and there's one more thing that ad hoc committee wanted to do, which is what we thought we might be able to do
at the meeting.
But we didn't. So that will then hand over to you, and that actually will be more informative, perhaps. You know, as long as you people have unanimity, as the president wanted us to have.
But we weren't supposed to have our meeting, to be honest with you. We didn't want our meeting because the board meeting was supposed to have finalized everything. We didn't get an opportunity to do that. So it would be prudent to give you a little bit more context from the committee's perspective at our last meeting, which I don't really want to have, but we can have.
Go ahead. Go ahead.
So I will say this. I think it's fair for whoever's in budget committee next, budget finance and growth committee next year to certainly talk through these the budget as it encumbers also what is being offered. I think my struggle though is that the board should also be the one that makes the priority, not an individual committee. And so anything that would be coming from a committee to propose the administration as far as priorities as to what should be done and what shouldn't be done should probably still go through the board, whether it's the first few meetings of the next year, to be the voice of the board, because I want to be careful that we are not saying and that we're going to do that you have to go do X, Y, and Z without the board having said that. But I also think these are great topics to have with the discussion of how we build our budget, recognizing that some things we are not going to be able to do, some things we're going to be able to do, some things we have to change. That's all a part of the growing budget conversation. It's part of the conversation that they're having to maybe transition us a little bit into the budget roundtables as well. That is just the reality that we have less money this year to do that stuff with than we had last year, and that everything is going to be a part of that conversation. But I would hope that we can at least get a little bit clearer as to when board communicates our priorities as a board versus when we are kind of doing messaging to get information, because I think that was more of what I felt came out of the discussion.
I think we're actually saying the same
I think it's
thing.
the same thing too.
Because your point about the whole board being able to talk about, prioritize it, and give a little bit more flesh to it, but the report's been handed to the administration. They're already starting to kind of work on it. The board did not have an opportunity to react as a board. There wasn't a vote, there wasn't this or that or whatever. So it's obvious that sometime in January, the board will probably reconvene on, and maybe this will be one of the topics. So I think we're all in the same, everybody's working on it, and it's moving ahead, as well as our budget efforts, which takes us to the roundtables. We have an update on our roundtables, and I have to clear something up that's circulating within the community. First of all, people have appreciated the transparency of the report and organizing it in the ways that you all have done, that not just fixed costs, but here are foundational costs, or however you've all done that, and saying some things are easy to cut and some things aren't so easy to cut, or what have you. I think that's been a positive, but there is, it's just circulated more as a result, I think, maybe in the last couple of roundtables, somehow the belief that the central office is off the table as to any cuts or changes at central office. That's, for some reason, that's circulating, and my understanding throughout what I looked at was everything's on the table. Do we have from the treasurer and superintendent?
Yeah, I can give the update. We've actually done most of the sessions. Mike Dustin has been at the sessions as well. So if it's not, Dr. Little has actually led most of them, and I've actually led three or four of them myself. So one of the things that we've shared collectively is our goal for the presentation overall is education. Like, we really want people to understand the background, it's very transparent in terms of open across the board. We have said pretty openly that everything is up for discussion. So there is not anything that is off limits. The one thing that was clarified because of an initial conversation, the very first conversation that we had, when we talked about what the state requires. So the state requires that you have a treasurer. It requires that each school has a principal. It requires that you have a superintendent. So that's that. So pretty much, except you got to have teachers. But the point with that is, when they look the way that it's categorized, when you look at, for example, the superintendent's office, all of those numbers all up under that same space. So that was a clarifying point in terms of what those numbers actually mean. So it's pretty clear. Exactly. So it's pretty clear that everything is up for discussion, and that there are, at this point, it was important, and I'm glad that you also brought that up, that we initially, anytime you start something like this, individuals have information that they want to share. You need to do this, you need to get rid of this, you need to not have this, all of those things. And so there are a lot of learnings that have happened through this. For example, there are individuals that did not realize that we had to pay for electricity, or they did not realize that, this is true, I'm not exaggerating, Mike was in the session where we talked about it, or they didn't realize that not only did we have to contract for buses, but we have to contract for fuel as well. So those are just basic examples of the lack of understanding around what we actually do as a part of our overall organization. So I would welcome anyone to review the online sessions that we have as well, because I think that it will clear up some of the misinformation. It's online. Well, we recorded one and put it online. And we have the virtual sessions. We have virtual sessions as well, but we recorded one to actually have online so that all of the questions that come up, the questions can be answered. And in terms of the survey, at the very end, the goal, as we shared from the very, very beginning, the goal is to have individuals to go through the session, go through the information, because they are not prepared to complete a survey without getting the information that goes along with it.
No, Derek, Mike, Aranetta all do a great job on it. I participated in a couple, but my calendar prevented me from doing a lot more, but got great feedback. There was, what I've been told is that it's very enlightening, very informative, very engaging, and very appreciated, and that people learned a lot.
Yes, I hear that a lot. I also hear a lot of the choices that are available or exemplified or whatever, or analyzed, are not necessarily things people want to cut. So I think that's very real too. So I think that's helpful. And things that we might think are priorities, members of the community think, hey, it's not really that important to us. When did that become important to you to have this or that or whatever? So I think it's more engagement, the better. And we have some more in January.
We do. We have, right now, we have 3 more. We had our last one for this calendar year last night at Woodward. We have 3 more in January right now scheduled. They start, I want to say January the 3rd or 4th. It's the first 2 weeks in January, because one of the things that we know is at this point, I mean, we've had probably, by the time we finish, it's like 10 or 12 sessions, I believe, if not more. As of last night, we've exceeded, we're at about 300 individuals that have participated in the roundtable discussions in terms of in-person or virtual. And there are others that have watched it online, you know, and to give feedback. And at that point, about mid-January, is when we'll really start reviewing the information in terms of the data to prepare proposals to share with the board.
So the incoming board needs to be aware that I'll leave more board discussion about budget at the conclusion of the roundtables, I would imagine, or paralleling.
I think we're shooting for the budget workshop, or the board budget workshop that's on the 20th. I think it's on the 20th of January.
I just saw this.
Yeah.
The Saturday work session?
Yeah.
The 27th, I think.
Oh, is it 27th? Okay.
It's
Towards the end of January.
Yeah.
Yeah.
Yes, go ahead.
Not related to the budget, but Ms. Indalacio came, not realizing that you took the benefits update off the agenda. So shall we give her a few minutes to give us an update?
Go for it. You get 2, but we're so glad to see you. Thank you. Oh, good. I get papers.
Oh my gosh.
Old school. You know it, babe. That's social studies.
Can we have an electronic? Save some trees.
I will give you a very quick update. Great. 2 minutes. This is a template we'll be using every month. This is the same one that I gave you a few months ago. I just want to thank you again for having us. The progress overview, if you want to skip to page 2 in the interest of time. There are 3 focus areas that we are working on based on the internal audit that was completed for benefits in 2020 and 2023. So we're still working up findings from both of those audits, working very hard to bring our practices up to speed and closer to industry standards. The first thing we're doing is developing accurate and efficient processes. Yesterday we had a joint meeting between the folks in the treasurer's office who deal with COBRA and home billing in our department as we work through where there might be gaps to identify both old invoices that haven't yet been paid and the current processes for how we're doing. Both sides report that current COBRA and home billing processes are running very well. The AR team gave lots of shout outs to our HR tech for the work that she's done on it. We still have a lot of work to do on some old COBRA invoices, so we're working very hard on that, and we've created a process for that. And I will be getting back to our chiefs today with information on what we crowned it as our next steps to try to recover some of those funds. We are improving data validation, and we did hire Benefit Focus as we contracted with them to be the team that is going to manage benefits. We will have our initial meeting with them over the winter recess with a long-term go live of June of 2024, and they will take care of open enrollment. They will take care of management of data and really help us to right-size the organization and make sure that our claims that are coming in are accurate, and they are against the heads that we're supposed to be covering and not against heads that we're not supposed to be covering. Seems pretty basic, but it's important work to be done, and there's lots of dollars to be found there and a lot of risk that we take if we don't do that good work. Finally, we're increasing our fiscal responsiveness. We hired an internal candidate, Thomas Connolly, to be our benefits analyst. We had the pleasure of working with Lauren last Friday to kind of get Thomas up to speed from her point of view on where we are with the audits. And next week, we're meeting with the entire IA team as well as with our talent team on benefits to really make sure that people thoroughly understand what the findings were so that we're going after the right questions and we're finding the right answers. Thank you.
Thank you. I appreciate it. If there's no questions, I just want to say thank you to the administration for a great year of information and dialogue and occasional humor and lengthy meetings. So have a great holiday. Again, thanks so much. Good luck to the next party. Happy holidays. If anybody else wants to do anything? Happy holidays.
Happy holidays, everybody. I make a motion that we adjourn. Motion.
Thank you. Now we are.